Hello YouTube, this video is for those who are looking for an idea on how to do this assessment or taking classes at Capella University. This is assessment number 2 titled Needs Analysis for Change for the class NHS-FPX6008, which is Economics and Decision Making in Healthcare. I took this class as part of my master's curriculum in nurse informatics. I hope you'll find it helpful. This is a title page. As you can see, this is formatted according to the APA 7th edition. Very simple. Needs analysis for change. As highlighted in my earlier analysis, a lack of adequate staffing in community healthcare remains a significant problem that affects the economic stability of the local health system. This shortage in the medical faculty, especially the physicians, nurses, and other clinical personnel, has severe repercussions and affects the healthcare facility on several fronts, such as access, quality, and cost. Moving on in the reflection on this issue, it is evident that some of the most oppressed sections in our society experience these impacts most gravely, thus making it is a mandate to consider those most affected by the various solutions brought forward seriously. Knowing the stages of the needs analysis will help healthcare workers act as change agents and enhance healthcare delivery. Summary of the economic issues and their impact. Insufficient staffing of healthcare facilities in my local community has led to longer wait times to secure appointments, and some clinics are cutting their working hours and relying more on locum staff, increasing the cost of delivering quality healthcare. While staffing shortages exist across rural settings, these gaps are even more severe in areas with low income, diverse racial and ethnic populations, and more prevalent conditions. Aldervik et al. 2021. These patients in these neighborhoods are already disadvantaged when seeking care. When the situation worsens due to understaffing, they make more visits to the emergency rooms, resulting in an increased incidence of preventable hospitalizations and improper management of chronic diseases. In the end, this vulnerable population's social health and economic risks worsen. Information on measures of quality that are ascribed to nurses, nursing care, and the contexts in which it occurs has limited research on staffing and outcomes. Although nurse leaders have debated defining and identifying outcome variables sensitive to nursing practice since the beginning of the 1960s, the use of nursing-sensitive outcomes and patient outcomes potentially sensitive to nursing is relatively recent. Healthy People 2030, no date. Here are some of the national trends that impact the cost of healthcare and its related consequences. Population aging, technological escalation in price, the cost of prescribing drugs, Affordable Care Act, ACA, and social determinants of health, Ballard et al. 2020. Patient care suffers, productivity drops, and outcomes get worse when facility staffing levels are inadequate since patient-to-staff ratios are thought to be too high. As previously marginalized clients in society who are most likely to suffer, the findings indicate that these population groups are disadvantaged since the group undergo an increased struggle in terms of obtaining healthcare that is both timely and high quality because most of them need help to afford adequate and competent healthcare personnel. The need for change, evidence-based insights. Sources of research and scholarly publications discuss the importance of responding to challenges such as poor staffing and help identify ways of supporting change plans. Many research studies have shown that a high patient-to-staff ratio contributes to adverse patient safety, quality of care, and healthcare expenditure. Healthy People 2030, no date. As a familiar with many health policies, there is a general understanding that nurses matter in healthcare because staffing affects the safety of patients, Ballard et al. 2020. However, there is a dissonance about what research has and has yet to prove, and what needs to be more apparent in the active disagreement on which policy will best help protect the public. These results underscore the importance of resolving the staffing problem to create positive change in the current condition and decrease healthcare costs associated with avoidable adverse effects. If there are insufficient healthcare workers, then not all patients are at the same risk of adverse outcomes. Patients who are elderly, have chronic diseases, are in a psychologically vulnerable state, or spend more time receiving care, especially under extensive comprehensive treatment, and face a wide variety of adverse events. Healthy People 2030 no date. For example, data on falls could be routinely collected on all patients admitted to a hospital, but the information may need to be more relevant for geriatric patients. Kanganovi et al. 2020. Besides patient safety and quality of care issues, costs associated with a shortage of nurses are also evident. Studies conducted by the American Hospital Association suggest that turnover costs for registered nurses, RNs, can be between $380,000 and $601,000 US dollars per year because of the factors mentioned above. Alderwick et al. 2021. Worsening this situation, a report by the Brookings Institution revealed that poor access to primacy care contributed to preventable readmission and emergency department visits, estimated to cost the U.S. $25 billion annually. Alderwick et al. 2021. Predicted outcomes and opportunities for growth. Some of the benefits that may arise from implementing changes to address inadequate staffing include the following. Proper staffing is significant because it can increase patient safety, improve patient satisfaction, and reduce adverse outcomes. Appropriate staffing also helps raise staff morale, decrease burnout, and enhance job satisfaction, thus improving staff retention and decreasing recruitment costs. Ballard et al. 2020. In addition, the staffing deficit has been elaborated in terms of matching supply and demand to enhance the utilization of what has been availed by patients, thus enhancing the financial manageability of healthcare institutions. Conclusion. In conclusion, a needs analysis of inadequate staffing supports the argument that change is necessary for healthcare organizations. The lack of low-skilled staff is an economic concern affecting healthcare professionals, the organizations, friends, and society. The problem persists even with existing gaps in socioeconomic and diversity perspectives. Therefore, it reaffirms the necessity of addressing the matter to promote a balanced availability of quality facilities in healthcare provision. Literature indicates that studies offer substantial proof regarding the need for change plans, which will further help enhance patient satisfaction and economic transformation. Adequate staffing not only improves the quality of patient care, the staff's engagement levels, and the financial resilience of the healthcare organization, but will ultimately result in a healthier population. This is the reference page. It is also the last page of the paper. Thank you for watching, and I hope you now have a better idea about how this assessment should look like for a submission. Thank you all. Boris Guerin. Bye.